The system that allowed this to take place is still in place. It barely has a scratch on it. The only positive thing is there are now tens of millions of people that are not likely to be fooled a second time. But the system's there. They just have to stick the key in and turn the engine over, and it will be running again. Nothing, literally nothing has changed. And
No.
this certainly goes back to the Nazis. This really goes back to the early part of the 20th century, even the late part of the 19th century, where government, bit by bit, incrementally started taking over regulation of the practice of medicine. And now some people say, well, that's got to be a good thing. It's not a good thing when a competent doctor is being told by a bureaucrat how to treat a particular patient. That is a very bad thing. And unfortunately, that is the norm now. Do you know that United Health employs nearly 10% of all practicing physicians in the United States today? One corporate entity, 10% of America's active practicing physicians looks to them for their paycheck. That's another really bad structural problem. Doctors should be independent. They shouldn't be looking to some corporate overlord or some CFO to tell them how to treat a particular patient. We're not machines, we're not, it's not pull out a part and put in another one. We're all different. We all require specific diagnosis. We all have different factors in our lives, and we need intelligent doctors to look at that universe of things that every person is and give the appropriate treatment for that person at that time. The idea that somebody in Washington can say, put them on remdesivir and ventilate them if they have a positive, it's inevitably going to lead to catastrophe. And again, I just want to say, unfortunately, that system has not changed, and we need to all recognize that and be aware of it because we still need to fight it.
Well, it's going to get worse because now they're pushing to have AI-controlled medicine, and AI-controlled medicine will be ran by AI created by Big Pharma and other crooks that's designed to do nothing other than to promote their corrupt practices and to sell their sick products that make you sicker and kill you. We just saw it. Why would we trust the people that just killed millions of people for profit to design the new medical system that we're all supposed to live under? It's sick. We have to empower our doctors. I don't have a problem with AI as a tool, but that's not what we're doing. We're going to give it authority. That's the goal because it leads to more profitability for the big pharma world that runs medicine.